Good evening. My name is Rachel Peters, and tonight I will be giving my informative speech on how countries have responded to a global pandemic. The title of my informative presentation is Pandemic, and its purpose is to inform. Have you ever considered what would happen to your life if a global pandemic spread across the globe, killing millions? I had never even considered the thought before I was pulled out of college and sent home for 6 months, when a deadly respiratory virus spread across the globe, putting all schools, businesses, travel, and more to a sudden halt. How would this occur with the technology we have today? How could it negatively impact that many individuals with the updated medical facilities and practices we have access to in the 21st century? As a college student, I would have laughed at anyone who had told me that a virus would interrupt my life and would have asked them those two same questions. But this virus, classified as COVID-19, has impacted in some way almost every individual on this planet, even with the technology and medical facilities we have access to. Tonight, we will look at 3 different countries and how COVID-19 has impacted them. The first country we will review that has been heavily impacted by COVID-19 is New Zealand. New Zealand's first 20 cases of COVID-19 were identified on March 18, 2020. As of today's date, October 26, 2020, New Zealand has had a total of 1,579 cases. Their population is 4.886 million people. New Zealand first began its fight against COVID-19 even before their first citizen was diagnosed. They began their prevention by implementing a travel ban, keeping foreigners from entering their country when traveling from China, and enforced a 14-day-long self-isolation after arrival. In March of 2020, New Zealand created a 4-stage alert system to determine necessary social safety practices to prevent the spread of COVID-19. Level 4 required that all residents follow a mandatory quarantine in their homes and were asked that only essential businesses operate in an in-person manner. Level 4 was reached by New Zealand on March 25, 2020, when the country contained only 189 cases. Because New Zealand responded to the virus in such a proactive and collective way, they are now functioning at a normal rate as before the virus began. Most of their schools, businesses, and jobs have reopened. There are still rules on traveling, and if cases were to spike once more, New Zealand would respond with the 4-stage alert system. But until then, they will continue to function as a normal country with only a few positive COVID cases occurring per week. Now that we've seen how New Zealand responded to COVID-19 and learned about their current state, let's look at the state of another country. The second country we will review is the United States. The U.S. first case of COVID was identified on January 22, 2020, much earlier than New Zealand's first case by 2 months. As of today, October 26, 2020, the United States has had a total of 8.64 million cases. Their population is 328.2 million people. The U.S. first began their prevention against COVID-19 back in January of 2017 during Obama's presidency, when he established a pandemic preparedness plan, which studied the influenza outbreak and considered ways to prevent a potential spread in the future. On May 13, 2017, the Trump administration proposed cutting this prevention plan by $277 million, but it was rejected by Congress. On February 2, 2020, President Trump enforced a travel ban for those entering the U.S. from China. On February 14th, the National Security Council recommended the closure of most public and private organizations and businesses, recommending a stay-at-home order. It also outlines the importance of limiting public gatherings and sporting events. But that did not happen until March 16th, over a month later, when the president finally announced social distancing guidelines to be in place for 2 weeks. On this date, the U.S. was infected with 3,774 cases of COVID. At this date, most businesses were closed, except for small and essential businesses. Because the U.S. took 3 months after their first diagnosed case to take measures to the level of quarantining its civilians, its spread became much worse than New Zealand's. Currently in the US, positive cases of COVID continue to increase at a rate of millions per week. Most businesses have reopened, but all employees and customers are required to wear masks upon entry. Gatherings are still limited and recommended to no more than 50 people per gathering. Now that we've understood how a delayed response to the COVID-19 outbreak can impact a country's number of cases, let's look at a final example. The third country we will review is France. The first case of COVID-19 in France was identified on January 25th, 2 days after the first case in the US. Their population is 66 million people, and as of today's date, France has a total of 1.4 million cases. France first began the response to COVID-19 in January 2020 by dispersing their social protection plans to medical organizations. These plans had been designed and edited since 2001 to prevent critical socioeconomic consequences after France witnessed the U.S. economy after 9/11. On March 17, 2020, France initiated a mandatory quarantine and closure of everything despite essential businesses. This was 16 days after the country announced its 100th case. This quarantine was profoundly serious, resulting in large fines and even arrests if broken or violated. It lasted a total of 55 days or 2 months. Although France had social protection plans in place for the preparation of a pandemic such as COVID-19, their cases continue to spike at an even faster rate than the US. This has to do with their inability to accommodate patients in their hospitals, as there is a patient overflow with the number of hospital rooms being less than the number of positive COVID patients in need of medical assistance. This crisis is a problem in larger cities, although has not impacted more rural parts of France, leaving the country in 2 different levels of social distancing and quarantine practices. Tonight, we have looked at 3 countries who have all been impacted by COVID-19 virus: New Zealand, the United States, and France. If you want to survive a global pandemic, stay educated on what other countries' responses are, and remember to respect and obey the policies in place for your protection by your government, as you never know when a pandemic could dismantle and change the way that you live. Thank you.